Good afternoon, everyone. This is Megan Fournier with the Home Care Alliance in Massachusetts. Thank you for calling in today. I'm here with Jake Krilovich, our Director of Legislative and Public Affairs. Before we begin, I just wanted to go over a couple of things and then I'll hand it over. First of all, you're all in mute only, but there is a questions tab in the sidebar that you have for the webinar, and we'll address questions at the end, but you're welcome to write them throughout the entire webinar for the opportunity so you remember what your question might be. This is also recorded, and once it's been processed, I'll send it out, so most likely later today. We'll also be putting it into our update newsletter so that other members who couldn't call in can listen to it. And I think that that's all I have. So without further ado, I'm going to hand it over to Jake.
Thanks, Megan. Good afternoon, everybody. Like Megan said, my name is Jake Krilovich. For those of you who don't know me, I'm the Director of Legislative and Public Affairs here at the Alliance. And, you know, what that means is I serve as the internal lobbyist for the Alliance, as well as advocacy issues throughout the state government, not just the legislature, but the executive branch, as well as the different state agencies with other colleagues of mine in the office. And so today is just a overview of, you know, what advocacy is, what it means to the Home Care Alliance and its members, as well as a little bit of a overview of what to expect this year, previous issues that we've dealt with in the past year, and some of the priorities that we'll be working on, and how we could engage you moving forward as members of the Alliance. So I'll begin with this question of what is advocacy, and I found several quotes about what advocacy is, but I chose this one, and it's from Dr. Seuss, the Lorax, and it says, unless someone like you cares an awful lot, nothing is going to get better. It's not. And I think that is kind of symbolic about what advocacy is to me. I think, you know, you see a lot of people who spend their lives advocating for certain issues or advocating on a daily basis, and then you can find people who might advocate here and there. And I think there's no right or wrong way or right amount of advocating that you could do, or you can never advocate too much. It's really what you want to make it for yourself and what it means to you. And so that's a broad overview of defining what advocacy is, but more broadly, more specifically what it is to the HCA and its members. We represent our members on Beacon Hill with the state legislature. We also have a bit of a presence in Washington, D.C. On the federal level. We lobby the executive branch, the legislative branch, as well as some of the agencies within the executive branch. Members of the Home Care Alliance bring issues to us. We look through them, we talk through them, we bring them to our board, we see what the scope of the issue is throughout the industry or throughout the legislature, and we make decisions on what we want to tackle in any given year. How our advocacy and our government affairs works at the Alliance. As you know, obviously I am here. We from time to time contract with external lobbyists on individual items or public relations firms. And you know, I spend a good deal of time on Beacon Hill in the legislature advocating for any of our issues. And from time to time, we bring members with us up there, and that's what we hope for, and that's what hopefully today will help, you know, harvest and maybe make you want to come and join us up there sometimes. Other ways that we advocate, we have an alert system. You might receive our emails. You might receive too many emails from me asking you to go into an alert system, and we'll talk about that a little bit later. And then we have a legislative committee, which I would encourage all of you to join if you're interested. Some of you might have already been on it, and we will share my email address later. But our legislative committee is just built up of certain members who have an interest in this, and I engage them occasionally and, you know, seek their input on certain issues and bring legislation to them and get their input on how it might affect them. But overall, advocacy, you know, as you all know, you're working in the field, many of you, and you know, advocacy is kind of it might be a second tier issue for you, but like I said, you don't have to do it every day. You don't have to do it, on every issue. It can be what you want if you care about an issue, if you feel like you want to make a difference, and that's great. But we can move on to 2017 and a little bit of a review of our successes and our failures, and how some of our advocacy efforts and how our members contributed to those. So we had several priorities in 2017, and these are in no particular order, but I'll start with the continuous skilled nursing program that the Alliance took on in 2016 and 2017. And this was an issue that we found, as with many issues of ours, reimbursement rates through Mass Health for the state's continuous skilled nursing program have been lagging. They haven't been increased in nearly 10 years, and it was resulting in agencies having difficulty finding nurses and being able to pay nurses adequate wages. So we came together with some of our providers, some of our members who do this work, and then a parent coalition that formed, built up of, I think, around 500 parents who have children in the program, and they wanted to come together and make a difference, and we kind of joined forces with them to give a parent-provider coalition. And the coalition has been incredibly successful. When going to Beacon Hill to legislators, it's helpful to have the parent stories there, combined with the provider stories to kind of round out the story and the situation. So we've been pretty successful in 2017. Since January 1st, 2017, we have received approximately 17% in rate reimbursement increases for this program, and that totals approximately $16 million. And so that's really an incredible feat, and it's kind of unheard of. I think just to briefly go over why this is such a success, I mentioned the combination of the parents and the providers. It really brought a compelling message to legislators and to the administration on why we have this issue. I think the stories and I think the access issues that we were able to prove helped really speed up the process and getting these increases. And then I think grassroots was a big deal. And what I mean by that is that I think the parents and our member agencies have sent, thousands of emails over the course of the year to the legislature and to the governor's office urging for these increases, really pitching this issue as a crisis, that the kids needed it now. They needed the care, and the care that they deserved. And so I think from 2017, that would probably be the flagship success story for the Alliance and its members, as a real model on how to advocate and bring a coalition forward to yield some change. Moving on to the worker registry, not quite a success, but I'll talk a little bit about how it could be viewed as somewhat of a success in terms of advocacy and how things do work. But I think the most important thing to remember here is, first, let me give you a background of the issue. This is a home care worker registry that was introduced a few years ago that would require any home care agency contracting with an ASAP to disclose their employees' private information like name, home address, their trainings, and what workers or what employer they work for. It's been a battle since before I came on. My predecessor had worked on it, and it's been kind of shoved off for the past few years. But this year, we weren't quite as successful. And I think it's a good example of how politics meets policy. This is an issue that was pushed forward by a powerful group on Beacon Hill. And when that's happening, it's difficult to push against that. And so the Alliance and some coalition members that we had formed, we had pushed all summer against the bill, citing privacy concerns and citing legal issues for our members. And, in large part, the bill was delayed for about a year before it passed. And I think it's a good example of, this is something that would have passed probably in a few weeks, or in the first budget process, had our members and had the Alliance not really stepped up with the coalition partners to raise these concerns. But sometimes the forces of politics prevail, and that's what we saw here. So in terms of what's next for the worker registry, we're still working on the issue. The bill was signed into law by Governor Baker right before or right after Thanksgiving, and it is subject to a regulations process that the Department of Elder Affairs will have to promulgate regulations around the bill. And so the Alliance is still continuing to work with our coalition partners to discuss, what we might want to see in that regulations process, as well as a potential legal action that might have to occur to protect our members and to protect the workforce. But like I said, it is, although it's unfortunate that this was signed into law, it is a good example of a group of people and a trade association and its members coming together to really push back on something that, like I said, would have probably passed much sooner than it did. And then lastly, we had a great federal success, as many of you had known, the HHGM proposal from CMS on the federal level, and the industry-wide is a perfect example of, an uproar and an advocacy uproar resulting in at least delaying the proposal and hoping that CMS would maybe consult the industry a little bit more when they try and craft the new proposal. Just as an example of how this was such a success, 17,000 emails were sent over a couple of days nationwide from the National Association of Home Care and Hospice. 200 of those emails were sent from Massachusetts, and then 300 emails were sent separately through the Home Care Alliance's advocacy alert system. So that was 500 emails sent just from Massachusetts in a few days, pushing back on, the legislature and trying to get them to urge CMS to pull the proposal and delay it at least. In addition, there were a couple of letters that circulated Congress, and as a result of some meetings that some of our members and myself took down in DC this fall, we were able to get 8 out of 9 members of Congress from Massachusetts to sign on to the letter. And then both senators, Warren and Markey's staff, made calls into CMS, a joint call into CMS to urge CMS to pull the proposal. So it's just a really good example of, these emails do work. They're not just, click-throughs that, members of Congress and legislators ignore. They do read them and they do take note of how many people are sending in. So I think a lot of people get discouraged and feel that members of Congress aren't listening to them. But in fact, they do. And it's something that you've seen as well with the efforts to repeal the Affordable Care Act. These uproars do work, and I think that's the biggest takeaway here is that, never be afraid to write your member of Congress or your legislator because they do listen. So look ahead. We'll just touch a little bit on some of the factors and the things to look out for heading into 2018 before getting into our priorities. So the political landscape, this is an election year, so all 200 members of the Massachusetts legislature will be up for election. And that typically means that it'll be a lower productive year for the legislature. It's also the second half of a 2-year session, meaning that the session will wrap up in July 31st, which gives them all of August off, and then, a quiet fall as they go for re-election. So, I think it'll be a light year. There are some things that they will act on. Of course, the budget appropriations that they're required to do. And then you'll see, the Alliance has heard rumors that the Elder Affairs Committee is looking to put out an omnibus bill that would take many of the proposals within their committee, many of the bills within their committee, and try and put together a comprehensive bill that works for everyone and that might have a little bit of everything in it. So the Alliance is advocating for certain initiatives in that bill, and we will be sure to keep you updated as it comes out. Another issue that'll be coming out is the House of Representatives is planning to unveil a cost containment package, a healthcare cost containment package. The Senate had passed a version of their own cost containment bill this past fall, and so now we're waiting for the House to unveil their first version, and we will see what's in that. Those are obviously efforts to lower healthcare costs in Massachusetts while maintaining access to care, which is always a difficult thing to do. And moving on to the 2018 Home Care Alliance priorities. I won't get too far into them, but in general, if you're able to see the slides, these are the priorities. So first, we have workforce wage issues. I think everyone would agree on the line that the workforce wage issues and our workforce issues in general are probably the biggest issues facing the industry as it grows and looks to grow in the coming years and our population ages. You know, we've come together with two other associations in the state to put together a package that seeks higher wages for home health aides, but we're also seeking wages for skilled nursing, and then, you know, the continuous skilled nursing remains a priority. I already mentioned the worker registry will be a big priority in 2018 as we look to continue to protect our workers and try and shape that regulations process as much as we can, while also considering any legal issues that come along with it. Licensure has long been a priority for the Alliance. We've advocated for a licensure process in Massachusetts. Massachusetts is one of, I believe, 8 states that doesn't have a licensure process for home health. In 2017, Governor Baker proposed a licensure process for skilled nurses or for skilled home health agencies, and that was signed into law. So, you know, there's 2 tracks. The Alliance will be pushing for our private care licensure legislation, as well as working with the Department of Public Health to formulate their regulations around licensure for skilled agencies. I had already mentioned continuous skilled nursing. We are advocating for a piece of legislation called the CSN Bill of Rights. It basically guarantees, you know, access, quality, and affordable care for these children, as well as regular rate reviews for the system for Mass Health to undertake. And then lastly, nurse delegation is a piece of legislation that we advocate for, that we might be able to or will be advocating in certain vehicles of the legislature. And as you know, this would allow nurses to delegate to workers underneath them certain tasks. And we believe it's a workforce issue. It would allow our workforce to become more skilled and broaden their skill set, while also saving money by saving nurses from having to do certain tasks. So how can you be an advocate? I have it broken down into 2 things: engage and act. We ask, you know, it's always important to engage with your legislators. Like I said earlier, you know, reaching out to them, sending them emails, especially on the state level. Legislators do read their emails that are listed online. They do reply in some cases. You know, seeing them in the district, going to campaign events in an election year, just going up to say hello, letting them know what you do. They're very interested. They want to hear from you. They want to hear their issues, and they want to hear from people in their district. So you know, you're always welcome to consult me beforehand, but never miss an opportunity if you'd like to go see your legislator, or if you want to come in to the city and meet with your legislator, we can set up a meeting with myself and them, and we can let them know some of the issues that are facing the Alliance, as well as your businesses yourself. Engage with the Home Care Alliance. You know, communicate with me. We'll share my email address afterwards. We have a lobby day on February 28th that will be seeking it's a workforce lobby day, so that for our workforce wage initiatives, it'll be at the State House, like I said, on February 28th at 10 a.m. And, you know, come out there for that. We also have meetings with certain agencies. We meet with Mass Health regularly. We meet with Elder Affairs, and many of those meetings make it into our update, and we ask for members to join us. And so, lobbying doesn't, or advocating doesn't just have to be at the State House. We ask members to come to the agencies to let the agencies know what's going on, and share your issues and work with them through those. And then lastly, like I mentioned, the Legislative Committee. If you just shoot me an email, we could join you to our Legislative Committee, and you can get some occasional updates from me on that. We seek out your opinions on certain issues, and it's a fairly informal group, but we come together every once in a while to discuss issues and where we want to go in the coming months. And then under ACT, I mentioned the emails and phone calls. I know, like I said, a lot of people believe they don't work. A lot of people get discouraged, or they'll receive a form letter in return. And, while that's discouraging, it doesn't mean that they're not listening or that they're not keeping track of, who is calling in. I think I saw Susan Collins during the, Senator Susan Collins from Maine during the Affordable Care Act repeal, and she flat out said, they're tracking the yeses and the no calls from their office to see how she was going to vote. So they do listen, they want to hear from you, and they do work. So that's the easiest way to become an advocate and the easiest way to really engage right now. It's so easy with social media and with all of our advocacy alert systems. It's an easy way to engage with your members and advocate a little bit. And then meetings with legislators. On one hand, you could email me to let me know that you'd like to come to a couple meetings, but occasionally we do send out emails seeking members from certain areas, or I might reach out to certain members seeing if they could come to a meeting with their legislator, because as many times as I could go to Beacon Hill or into the State House, it's much more beneficial when legislators and their staffs hear from you guys who are actually in the district or who are actually in the field, and can hear from you guys. So I always encourage to meet. It's a great thing to do. It's exciting, and it's fun to meet with a legislator, and it's a good way to engage them. But I believe that's all we have. I know that was fairly quick and a lot of information, but I think Megan can open the line for any questions that you have.
For the sake of extra noises, if you have any questions, you can actually write it into the questions tab in the sidebar that you have. And while we're waiting for anyone, if they do have any questions, Jake is always, his email is always around, and our number, which again we'll pass around. But you might not have a question right now, but it's never too late to ask a question. I will say that I'm as the event person, I oftentimes meet with multiple different members, throughout the state while doing programs, and I'll have people come up to me all the time saying, "Why isn't this changing? Why is this a problem? Are you guys doing anything about it?" And more times than not, the answer is yes. But as Jake was saying, I mean, we're one person essentially, whereas you guys are multiple members, and you make a big difference by adding that extra voice in there. But also, if you ever have any questions, if we are handling something, we want to hear about it, because we know that, maybe we don't know that something's an issue and we haven't heard about it yet, or people assume that we already know about it. So I just know that, oftentimes people think that, we might be just sitting around just kind of like hoping for the best, but I know, Jake is out every day advocating for you guys, and by sharing this, these things with your staff too, that just adds the numbers of people that will be able to advocate for this industry, because I feel like sometimes we're the bottom of a totem pole, it feels like, and the more help, the better. It doesn't seem like we have any questions right now, but again, if you have any, please contact us anytime. Actually, we do have a hand, oh, never mind. All right, so again, if you have any questions, contact us. This was recorded because, as Jake said, it is a lot of information. We're constantly doing new things. So, I mean, Jake, what's the best way of being updated when we're working on something new?
Yeah, so we always put something weekly in our update about what I'm working on. I submit something. Then our legislative committees, like I said, a good way. And if there's any issue today, I didn't really get into bill numbers or what legislation is or that we're actually working on these issues does. I didn't want to get too in the weeds policy-wise, but if you have any issues or are interested in any of these items that we talked about, just reach out to me, and we could have a phone call and we could really get into it and talk about each side and the political viability of it and what we think might happen, because there's a certain issue on every way. And I think what Megan said was perfect, because I think a lot of people get discouraged through this process because it is an ugly process. Democracy isn't a pretty process. It's not very fast. People get discouraged when what they seem are their common sense issues. They don't seem to get acknowledged, or the legislature will overlook them. And it's important to remember it's not personal. It's just that there's so many priorities for these legislators to consider, and it's just a matter of getting one of them to latch on.
Oh, actually, we do have one question before we end. Will the licensure issue encompass certificate of need and or prohibiting out-of-state providers from entering Mass to provide care?
Yeah, that's a good question. I think Pat and I had talked about this yesterday, in that the Alliance had, I think, previously advocated for that, but under the current proposals or the current legislation that we're pushing for private care, it does not. But then in terms of what the governor's budget passed, it does not include any language about certificate of need. Now, that's not to say that the regulations wouldn't include that, but at this point, there's nothing in writing.
We had someone else just ask a quick question about getting a copy of the handouts and how you're going to be able to listen to the recording. I'm going to send out the handouts with the recording as well, so you can take a look at it and write any notes if you want to listen to it again. And the recording will just be a link to a YouTube page that you'll be able to watch as many times as you like. And you can send it out. This is the type of topic that we want as many people to listen to as possible, so you know what's going on and what we're doing. So feel free to send to your staff or to a friend of yours that just wants to know about the home health industry. This will be open to the public for people to listen to. So, all right. So I think that we're all set now. And I hope you all have a great rest of your day. Thank you all very much for listening in today.